Hey, KEWP podcast listeners. I'm here today with Dr. Dawson. Is that correct?
That's right.
And he is the founder and CEO of Wild Health here in Lexington, Kentucky. And he was kind enough to invite us into his beautiful office today to talk a little bit about the pandemic and some things that we can do during the pandemic, but also talk a little bit about some of the new things in science with genetic testing and how that can help patients maybe understand a little bit more about themselves and what they can do to make themselves a little more healthy. So thank you very much for having us in today.
Thank you.
I got to ask you, and I'm sure you probably get this question from time to time, but the name Wild Health for medical practice is a little bit unusual. I guess maybe from a marketing standpoint, that's a great thing, but how did you get the name Wild Health?
Sure. So the word wild really means a couple things. So in our practice, everybody we see, we do genetic testing, we sequence their DNA, we do a lot of really kind of high-tech, kind of wild and out there things. It's a different way to practice medicine, but it also is an allusion to wild and wilderness and in nature. We think most of what people need to really be well and to heal is found in nature, and we're disconnected from that. So we take an approach that's both kind of cutting edge science and ancestral wisdom. We'll talk about the basics and things that maybe your great-great-grandmother taught you just from ancestral wisdom as well. So it's an allusion to both of those things.
Would you agree that a lot of things that we used to do, let's call it folk medicine or herbalism, but there are things that you would hear get passed down from generations to help with an indigestion or something like that, that now we're turning back to and saying, well, you know what, a lot of those things did work. Is that kind of what you're talking about? Is some of the nature from medicine as opposed to something from a laboratory?
Sure. I think a great example of that is food. Most of what we find in the grocery store I don't consider food. I consider it calories and chemicals, the combination of the two. And if your great-great-grandmother wouldn't recognize it as a food, then I don't really consider it a food. Plants and animals are food, but a lot of the processed things that we eat are not. So that's kind of an example of the wild and wilderness and nature part of Wild Health.
Genetically modified food, corn, things like that, they've all been genetically modified to resist certain actual fungicides and resist certain insects, I guess. What's your opinion just on genetically modified foods?
So I think there's concern there. I think we don't have great evidence that it's harmful for us. We don't have enough experience to know that it's not harmful for us yet. So I think the jury is out on genetically modified foods. They have increased the food supply. There's more food available. But we really just don't know what's going to happen when we tamper with nature like that. If you give me the choice between a wild strawberry and a genetically modified strawberry, I'm going to take the wild one every day. Those thousands of years it's had, and I just feel more safer and it's more nutrient dense. So the more we can have foods that are wild and not really genetically modified, I think the better for us in general. And I don't have great scientific evidence or papers to say that genetically modified is bad for us. I just think we're playing a risky game when we do that.
Well, since we're talking about genetics, you said that you genetically test your patients when they become a patient of your practice. Genetic sequencing is something that's new to a lot of people. How do you utilize that here in your practice, and how do you apply that to your patients?
So we think the way that medicine is practiced right now is kind of broken. So right now, if you go to your physician and say, hey, I've got this problem, what should I do? And they say, well, this has been proven to work, so do this. What they're really saying is that this was proven to work for 60% of people, or maybe 80 or maybe 85% of people. That's how studies are ran. Like It's all based on statistics and epidemiology. We think we can do much better than that by actually looking at someone's DNA and figuring out what works for them. So the reason we founded Wild Health, my co-founder and I, several years ago, he had a really big problem with his lipids, with his cholesterol. He was recommended to eat a diet that works for most people, but made him worse. His doctor put him on a statin, and he got muscle breakdown and myopathy from that. And around that time, we were seeing the evidence emerge for personalized medicine, precision medicine based on DNA, and we sequenced our own DNA. This was several years ago. And pretty quickly, when we were looking at his DNA, we saw that he needed to be on the opposite diet of what was recommended to him. And we also saw that statin, which gave him muscle breakdown and myopathy, he had a specific single nucleotide polymorphism that made him almost guaranteed to get that. So we were pretty aggravated, like, why did his doctor not know this and do these tests? And we realized that no one was doing this. The science was there, the evidence was there, but medicine wasn't being practiced that way yet. And usually medicine is about 30 years behind.
Sure.
And the fact that this evidence is only 5 to 10 years old, we knew it was going to be a while before it was in the mainstream. And we weren't happy about that. We weren't that patient. And so we left traditional medicine and started practicing this way.
Well, I congratulate you for that forethought, because it's something that I have thought about for years as well. Why are we always tending to treat a symptom? Why don't we look at maybe an underlying cause or condition and work from that end? Nutrition's a big part of that. So once they were able to crack the code, so to speak, in the DNA, I guess that opened up this field. And I'm glad that you and your co-founder are here doing that, because I think that is the correct way to practice medicine. So we will leave a link in the description for Wild Health and how they can find you on the web and all that. So if you're looking for a doctor who sees things a little bit differently, maybe this is somebody you would want to see. But we came here to talk a little bit about the COVID and the pandemic. I kind of want to get your perspective on a few things, because you kind of approach medicine from a different perspective. You hear from the pandemic, you hear the CDC guidelines of we should all be wearing masks, we should all wash our hands, we should all social distance. And those are all good pieces of advice. But you don't hear much about what people can do to maybe be proactive and maybe build their immune system or do things that can help, if they were to contract the virus, put themselves in the best possible position to fight the virus off. Do you have an opinion about that, what people can do to help with maybe some proactive things?
Yeah, there are lots of things to do. So in our practice, we take a proactive approach to everything. We try to optimize people by getting them on the right diet for their genetics and their lab work, the right sleep regimen, the right supplements, the right exercise program. Those fundamentals and those core things are what are going to lead to an optimized immune system, and they're going to decrease your chances of having a bad outcome from COVID. Mm-hmm. So it's not going to sound exciting, but just the basics like sleep. Sleep plays a critical role in your immune optimization. There's been some really interesting studies on sleep right before a vaccine. So everyone's talking about vaccines right now. So they've done studies where the flu vaccine every year, when you get it, your immune response, how well you respond, is very much dependent on how well you slept the night before.
Wow,
so it's something to think about now. So the better night's sleep you get, the better your immune system is going to be. But once they do come out with the vaccine, when you get that vaccine, it's really important that the night before you get a good night's sleep. Ideally the week before, but especially the night before. It's going to affect the efficacy of the vaccine.
Okay. So
something that simple. I mean, if I could say one thing to people, everyone knows you got to exercise, you got to eat healthy, do all those things right. But just sleep itself is probably the most important thing that I don't hear people talk about.
I haven't heard anybody talk about that, and I'm so glad you brought it up, because recently I have an Apple Watch and I've got the sleep app and all that on there, and it has been insightful to realize how maybe I didn't sleep very well that night, or maybe I slept better than I thought that I slept a certain night. But now we're really starting to pay attention to sleep, that we're really starting to say that's one of the pillars of optimal health is good sleep. So I had no idea that the efficacy of a vaccine mattered on how well you slept the night or the week before. So that's new information, and that's great information.
And there's a lot that we can do with sleep now that we didn't know about even 5 years ago. So for example, maybe my favorite possession I own is this. It's called an Oura Ring. It tracks my sleep. So every morning when I wake up, I know not just how much sleep I have, but how much deep sleep, how much REM sleep, my entire sleep architecture. So having that, being able to measure it, I'm able to optimize it. So when I first got this ring, I was getting 15 minutes of deep sleep. That's not enough, and now I get at least an hour and a half every night. And the way I was able to do that is the same way we do with all of our patients. So we can track the data, look for maybe a week or 2 weeks at how their sleep is, see where the issue is, what part of the sleep cycle, and then we can make recommendations based on that and their genetics. So for example, for me, I had a fatty acid amide hydrolase SNP that meant that CBD would probably be beneficial, and it did. It made a big difference for me. You may also see that you have an MTNR1A or MTNR1B related to melatonin receptors and related to when you eat at night. It's going to make a difference. So we can look at the genetics, and then we can look at actually what you do, and then we can do what we call N of 1 experiments. So based on your genetics and looking at your sleep, I say this is probably most likely to have a benefit, and let's try it for a week. And if it does, great. If it doesn't, let's go to the next thing, because we get recommendations all the time: do this, do that, don't do that for your sleep. But people are complicated, and so we like to start with the DNA, start with objective data, but then run experiments and see what actually works for people. And being able to measure something like sleep is how you're able to do those experiments effectively.
Since you mentioned the Oura ring, this is just an off-the-topic subject, but do you know Peter Attia, Dr. Attia?
Yeah.
So I really like a lot of his information that he puts out there. And he was the first person that I really listened to that started talking about sleep. And it was kind of a kick in the head to me about why I wasn't paying much attention to sleep. I just thought you went to sleep and you woke up and you felt how you felt. Maybe your allergies were bad that day and you just don't feel as well as you thought that you should feel. However, then I started listening to him and I started kind of tracking my sleep, and then I did realize that there are some things that you can do to proactively help yourself, put yourself in the best position to get a good night's sleep. And it has helped me.
Yeah.
So I'm glad that you're also introducing that to your patients as well. Well, since you do listen to Dr. Attia, then I have to ask you about fasting, because he's a big proponent of intermittent or time restricted feeding. But he will go on long fasts, which I can't do. I've tried to do the 5 to 7 day fasts, and I can't. He's got more willpower than I do. But I can do the 3 to 4 days pretty well. And he seems to think that maybe the shorter fasts peak the immune system a little bit better than the longer fast. Do you have an opinion about fasting and the immune system?
Yeah, so everyone's different. What we recommend for our patients is vastly different. From some people, just a 12-hour fast is all they need for whatever body composition reasons, hormonal reasons, other things. Other people do benefit from 3 to 5 day fast, and even longer if they have. I just had a patient an hour ago had really bad insulin resistance issues, and that's probably the most powerful intervention I have to fix that. So it depends on the person. When it comes to immune function, sleep is similar, or I'm sorry, fasting is similar to something like exercise. They have benefits, but they're acute stressors. So you have the acute stress, and then you get stronger from it. But you have to be careful if, for example, in a pandemic situation, because fasting will lower your immune function transiently, and then you'll get the benefit later.
Right.
So personally, I am a little less bullish on the longer fasts during the pandemic. I think shorter fasts, intermittent fasting, or what should be called time-restricted feeding, where you have maybe an 8-hour window you're eating and
right.
That's probably the better approach right now. As we're going into cold and flu season, we want to optimize our immune system. It's probably not necessarily the time for the longer 3 and 4 day fast.
Okay.
Because you are slightly more vulnerable during those periods. But once we come out of this, then I think that's probably the time for the longer fast. And it'll be the same with exercise. If you look at people who exercise, if you take sedentary people who don't and compare them to people who do exercise, the people who exercise have a better immune function. But if you go further down the spectrum and you look at ultramarathon and endurance athletes, they generally have suppressed immune systems when they're doing their real high volume training. Right. So the same thing with fasting. A long fast is going to have benefits, but it's an acute stressor and has some risk with it. Same thing with long endurance running. There's some benefits, but if you put the big volume times when you're higher likelihood to get a cold and flu during those times.
So it's talking about stress. We know definitively that if you're under emotional or physical stress, that it can have an adverse effect on your immune system. Are there any things that you can suggest to people to help? Because the pandemic in and of itself is stressful to people. Are there some things that you can suggest to help lower that maybe emotional stress or physical stress that will put them in a better position in case they were to get the...
Yeah, I'm going to sound like a broken record, but the number one thing is sleep.
Okay.
Adequate sleep is the number one thing. It's going to decrease your cortisol levels, improve stress. Now, there's obviously people know mindfulness, meditation, those things are really important. An interesting quote that I really like is that Dalai Lama said, sleep is the best meditation. So even the Dalai Lama, someone who meditates a lot,
Right.
points to the importance of sleep first, and then the mindfulness and meditation. Having some sort of meditative practice has been shown over and over in studies to reduce stress, improve your immune function, like we've been talking about, and just lead to overall good results. So whatever that is for you, there's so many different types of meditation. There's a lot of great apps out there as well. So just downloading one of those and doing some guided meditations is a great way to get started and reduce your stress levels in a scientific, evidence-based way.
As a physician, just in general, how do you assess somebody's immune system?
It's a good question. There aren't really great laboratory tests to tell us how good your immune system is. We can certainly see if you have a repressed immune system with your white blood cell count and some other markers like that. But most people, if they're not on chemotherapy or have some other issue like that, we're not going to find that on lab testing. Also, obviously, we can check antibody levels for different things, but we don't have great ways to check like T cell function against a virus or other innate immune systems. So there's not a great way to assess it. We know what improves it, which is good sleep, good diet, good amount of exercise, and moderate amount of exercise. But we don't have great tests, and we don't have a great 1 to 10 score on how your immune system is.
Yeah, I've got someone in my mind that I'm thinking about that seems to be outwardly very, very healthy, but every time they get a little scratch or nick, they seem to get infections. And I've always said you must have a suppressed immune system, although they do all the right things. And I was just wondering if there's anything anecdotally you could even look at to say, oh, that person has a pretty good immune system, or maybe that person. I think we've gotten so antiseptic as a society. And I have a friend who's a veterinarian, and he says, in his opinion, we've gotten so antiseptic that we're actually doing some harm to our immune systems, that we're not getting dirty, we're not getting bugs, germs on us to kind of have a heightened immune response or an immune system. And he kind of feels like that just as a society we've gotten away from that. Do you have an opinion about that?
Yeah, it's called the hygiene hypothesis.
Okay.
A lot of people have hypothesized that we are so antiseptic that we have suppressed our microbiome and our natural defenses. So it is something. There are some studies on kids who are raised with pets or without, and the kids that are raised with pets and kids that are raised on farms tend to have stronger immune systems, less allergies, and so I think that is a real thing. And right now we do need to be kind of extra clean, washing our hands more and things. I worry that after the pandemic is over, a lot of that will stick with us and isn't necessarily needed, but it's a tough thing to balance. Like we want to wash our hands and be clean right now, but at some point being exposed and making sure our microbiome is strong is a good thing as well. That's one of the things that we do. You mentioned testing for immune function. It's not a test for immune function per se, but we do microbiome testing. A lot of times people just look at their diversity and if they have any gut inflammation going on. And in general, lower microbial diversity in your gut has been associated with depressed immune function, although it's not a real one-to-one causation, it's more a correlation.
So when you're assessing a patient or you're looking at a new patient, you're looking at them from the inside out. You're obviously looking at their genetic sequencing and testing and seeing if they're predisposed to something. You're looking at their microbiome and just in general. So this is just nothing more than just an opinion on you. Would you say that we as a population don't have a very good understanding, just in general, of how the body works and how that we should be preparing the body to have a good, healthy lifestyle, that most of us are just clueless basically about what we should be doing and what we're probably not doing?
So we know more now than we ever have.
Right.
But it feels like the more we learn, the more we realize there is to learn.
Right.
Even the microbiome, like we just talked about. No one would talked about that 10 years ago,
Right.
but now it's fascinating. There are studies with rats where you take rats and you raise them in a germ-free environment, meaning they have no microbiome.
Right.
Then you give one set of mice microbiome from an obese person and one set of mice microbiome from a lean person. Feed them the exact same food, and they get obese or lean depending on their microbiome with the exact same
Wow.
food. It's a fascinating thing, and so we're trying to translate that to humans now. But the more we learn about things like the microbiome, the more we realize we don't know. It's like the depths of the ocean. We're just a few feet below the surface right now.
Right.
So we do know a lot. We can affect quite a bit, but there's so much more. The more we learn, the more we realize we don't know.
I think you said something early on that I want our listeners to really pay attention to is people are complicated, and just because somebody says that they tried this and it worked for them, that doesn't mean that it's going to work for you. And I think if you're thinking about, if your next door neighbor comes over to tell you that they've been eating, goji berries and they're feeling great, that doesn't necessarily mean that you should go right out and buy that. What you should do is you should come and see a trained physician like Dr. Dawson and let him do the things that he does, so that you know that what you're doing is working for you, because we're all individuals, and a lot of what you're practicing as far as medicine goes is specific to that patient, and I think that's the key. I think that's something that's been missing in medicine, and obviously you thought the same thing for a long time. Too many times you go see your physician and they say, well, take this and it'll help but they're helping the symptom. It's not really going to cure maybe a long-term or a chronic situation that the person may be experiencing, and you're addressing potentially the chronic or the root cause of something, and sets them up for a lifetime of being well, as opposed to what's in a bottle and makes them feel a little bit better for a short period of time.
Yeah, it's completely personalized.
Right.
Like, everyone is different. And it's important to take a holistic approach too, and also to be humble about it as a physician. So when I said earlier, we think what's the perfect diet for you, so it'll depend somewhat on genetics. For example, you may have a VDR SNP that means you're going to be genetically predisposed to be low in vitamin D. Well, we need to know, what is your vitamin D level? Let's check
Right.
that. And then based on what it is, are you in Kentucky going into the winter, or are you in Florida in the summer? Because you're going to get a different amounts from the sun. So talking to you, knowing where you are in time and space, and seeing the genetics and labs are going to tell us, okay, you need to take 2,000 international units of vitamin D a day, or you just need to eat more shiitake mushrooms if you like those. Or if you don't, then you need to eat some organ meats or
Right.
whatever else is high in vitamin D. So it's the conversation, the genetics, the blood work, the context, all of it together. And then when I said we need to be humble, if we want to raise your vitamin D level, then we can make a hypothesis based on all of those factors I said, you should take this. But then we need to be objective and test it again and say, in 2 months we want you to be at this level, we think you will, but let's retest it and see where we are. Because what we practice, we call it precision medicine. It is more precise, but it's not perfect. People are complicated, situations are always changing, and so it's that relationship over time, and applying the science is where we get the real power and able to make the real differences.
Well, I got to tell you, personally, I could sit here all day and talk to you. You're exactly the type of physician that I think most people should be associated with. But you're smart, and you're approaching things from the right perspective, in my opinion. So, you're a busy guy. I can't take up a whole lot more of your time, but maybe I could come back at another time and speak to you again. I really have appreciated you taking the time to be with us today.
This is what we do. It's what we're obsessed with. We'd be happy to talk to you about it any time.
So any of you who are looking for a great physician, we'll put everything in the description. Just click on that. We'll have the Wild Health link that you can find you through the web, or contact you via phone or whatever. And right here in Lexington, and feel free to give him a call, and we'll talk to you next time.